Hello nurses, how are you all? Welcome back to my channel Nurse Navigator Swati. I'm back with the second part of Medical Surgical Nursing MCQ question and answers. Quickly go through my part 1, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. A client connected to the cardiac monitor shows an ECG waveform with a sawtooth appearance which indicates options are atrial flutter, atrial fibrillation, ventricular tachycardia or ventricular fibrillation. In ECG, sawtooth appearance is visible in case of atrial flutter, as in typical atrial flutter, the electrical impulse travels in a counterclockwise loop within the right atrium. As a result, it shows a sawtooth appearance. Question number 2. How will you instruct the students to record the client's pulse rate that is found above normal? So the options are tachypnea, hyperpyrexia, arrhythmia or option 4 tachycardia. Yes, increased heart rate which is termed as tachycardia, option 4 is the right answer. Question number 3. Our client is admitted to the hospital and has edematous ankles. What should a nurse instruct to do to reduce edema to the lower extremities? Options are restrict fluids, elevate the legs, apply elastic adhesive bandages or do ROM exercise. Correct answer is option 2, elevate the leg. Only elevation can reduce the edema. Next question. A client with GERD complains about having difficulty sleeping at night. What should the nurse instruct the client to do? Options are sleep on several pillows, eliminate carbohydrate from the diet, suggest glass of milk before sleep or option 4 take antacids. Yes, the correct answer is option 1. The nurse will instruct the patient to sleep on several pillows to reduce regurgitation. Question number 5. Before cholecystectomy, the physician orders vitamin K. The nurse understands that this is administered because it is used in the formation of options are bilirubin, prothrombin, thromboplastin or cholecystokinin. Yes, for the production of prothrombin, vitamin K is prescribed. So the correct answer is option 2, prothrombin. Question number 6. Which explanation is accurate regarding intussusception? Options are kinking of bowel into itself, option 2 band of connective tissue compressing the bowel or option 3 telescoping of proximal loop to the distal loop or option 4 protrusion of an organ through wall. Yes, intussusception denotes telescoping of proximal loop to the distal loop, so the correct answer is option 3. Next question. When evaluating fluid loss in a burnt patient, the nurse understands that the relationship between the surface area and fluid loss is options equal, unrelated, inversely related or directly proportional. Yes, the relationship between the surface area and the fluid loss in case of burn is directly proportional. So option 4 is the right answer. Question number 8. To enhance absorption of calcium, which vitamin is needed? Options are vitamin K, vitamin E, vitamin D or vitamin A. The correct answer is vitamin D, which is very much needed for the absorption of calcium. Now the next question. Which of the following organisms is responsible for the development of rheumatic fever? Options are streptococcal pneumonia, Haemophilus influenza, group A beta hemolytic streptococcus or option 4 Staphylococcus aureus. For the development of rheumatic fever, group A beta hemolytic streptococcus is the organism, so option 3 is the correct answer. Now question number 10. Resonance is best described as options are sounds created by air-filled lungs, option 2 short, high pitch and threading, option 3 moderately loud and musical quality or option 4 drum-like. Yes, resonance is that type of sound which is created by the air-filled lungs. So option 1 is the correct answer. Question number 11. The category of drug that acts to prevent blood from clotting is options are analgesic, antibiotic, anticoagulant or option 4 antidiuretic. Yes, anticoagulant is that type of drug which prevent blood from clotting. So option 3 is the right answer. Now the next question. The 12-year-old boy has fractured his arm. After the injury is casted, the nurse has to perform all of the following assessment except options are capillary refill, radial ulnar pulse, finger movement and option 4 skin integrity. Yes, capillary refill, radial ulnar pulse checking, finger movement all will be checked by the nurse except checking skin integrity in case of fracture. So option 4 is the correct answer. Next question, a client is prescribed long-term rest after surgery. Which complication does the nurse expect to prevent by teaching the client to avoid pressure on the popliteal space? Options are cerebral embolism, pulmonary embolism, dry gangrene of the limb, or coronary vessel occlusion. The correct answer is option 2. For the prevention of pulmonary embolism, the nurse should advise to avoid pressure on the popliteal space. Next question, among the following, identify the long-term effect of steroid therapy. Options are hypoglycemia, loss of hair, loss of weight, or steroid psychosis. Yes, option 4, steroid psychosis is the long-term effect of steroid therapy. Okay, next question, which is the best test to detect iron deficiency in a client? Options are ferrous sulfate, serum ferritinin, serum iron, or hemoglobin. Yes, option 2, serum ferritinin is the best test to detect iron deficiency in a client. Question number 16, which of the following condition is associated with increased intraocular pressure? Options are cataract, conjunctivitis, retinitis, or option 4, glaucoma. Yes, glaucoma is such a condition which is associated with increased intraocular pressure, so option 4 is the correct answer. Question number 17, which among the following signs and symptoms will be present in a patient with hypovolemia? Options are increased heart rate, hypertension, bounding pulse, or urine output 30 ml per hour. The correct answer, increased heart rate will be present in case of hypovolemia. Question number 18, which of the following nursing diagnosis is a priority for a patient diagnosed with pneumonia? Options are fluid volume deficit, impaired gas exchange, ineffective coping, or option 4, risk for infection. For a patient with pneumonia, the priority diagnosis will be option 2, impaired gas exchange. Question number 19, which of the following is the initial symptom of perforated duodenal ulcer? Options are hyperpyrexia, mild epigastric pain, projectile vomiting, or heartburn. Yes, the initial symptom for the perforated duodenal ulcer will be mild gastric pain, so option 2 is the right answer. Question number 20, which condition is assessed using Braden scale? Options are burn injury, bed sore, muscle strength, or anxiety level of a patient. Yes, Braden scale is used for risk assessment of a bed sore, so option 2 is the right answer. Question number 21, which of the following is caused due to the spasm of the coronary artery? Options are stable angina, variant angina, unstable angina, or option 4, myocardial infarction. Yes, you are right, because of the spasm of the coronary artery, variant angina is developed, so option 2 is the correct answer. Question number 22, which among the following is correct method regarding iron supplementation? Options are take it along with milk, take it along with lemon juice, take it along with water, or option 4, take it after having food. Yes, the correct method regarding iron supplementation is always take it along with lemon juice. So option 2 is the correct answer. Next question, tissue plasminogen activator TPA is to be administered to a patient in the trauma and emergency unit. Which of the following is a priority action? Options are check apical pulse, check serum electrolyte, check sign of bleeding, or check blood grouping and cross matching. For administration of plasminogen activator, always the first priority is to check sign of any bleeding. So option 3 is the correct answer. Question number 24. The term paracentesis refers to, options are puncture into the pleural cavity for the removal of pleural fluid or air. Option 2, removal of the fluid from the peritoneal cavity. Option 3, aspiration of CSF from the lumbar region. Or option 4, inflammation of thorax and abdomen. Yes, paracentesis means removal of the fluid from the peritoneal cavity. So option 2 is the correct answer. Today's last question. Tracheostomy is usually performed between the tracheal rings of cartilage of, options are second and third, option 2 third and fourth, option 3 fourth and fifth, or option 4 all of the above. Yes, you are right, tracheostomy must be done within the fourth and fifth cartilage, so option 3 is the correct answer. Let me know how much you have scored from this video, and also mention me in the comment the topic on which you want more MCQs and explanation. See you soon in my next nursing quiz session.